We're going to show how to do an application of maggots on our plastic foot here, so we can see exactly how to apply the maggots effectively and quickly. So before you start, you need to prepare your trolley, make sure that you have everything available for your application. So you'll need your hydrocolloid dressing, which is going to frame your wound. You're going to need some saline. You're going to need some sterile gauze, preferably non-woven if you can, and some Tegaderm or Opsite, which is going to seal your wound edges. That will contain your primary dressing. And then for your secondary dressing, we advise just to use some simple non-woven gauze as your secondary dressing, sealed with some tape or a light bandage. So we're going to start off, obviously you'll have cleaned the wounds with some saline prior to application. I'm wearing sterile gloves and Samantha's going to do my removals for packaging and keeping everything else separate from everything that's clean here. First of all, we need to use the hydrocolloid. Normally I would cut this into 4 sections, okay? So you're cutting against the actual direction of your dressing, so your dressing can open up. You want to try and gut it against this, okay? So you're cutting it into 4 equal sections. Okay. And then with each section, if you just place some darts into it, we're cutting about halfway down into the hydrocolloid. So do this in a couple. Okay. And then by removing the backing, keeping the dart section you just cut away from the wound, so the section that's still intact goes next to your wound, going around the wound margins, going as close to the wound edges as you can. Okay, and then just taking your next piece, doing the same. What you want to try and avoid is causing any of your hydrocolloid dressing to actually overlap each other, because that could be an escape route for the maggots. So try and just keep the hydrocolloid smooth from one section to the next. So I'll just cut this bit off so it's not overlapping the last piece of the hydrocolloid. So that's your wound now, has your hydrocolloid in place. Now the hydrocolloid used to act as a cage, the base cage for your maggots, and also it protects the healthy skin around the wound margins so that the wound edges don't become damaged or traumatized by the maggot secretions themselves, okay? So now we need to rinse the saline into the vials to get the maggots out of the vials and onto some sterile gauze. So I've got some sterile gauze here. Okay, is that them all? Okay, so now we've got the maggots onto the gauze. We're just going to invert that straight into the wound itself. Trying to make sure that the gauze stays inside your hydrocolloid and into the wound bed itself. And I would put another couple of layers of gauze on top, dry gauze, covering your wound entirely, but making sure that the gauze stays within your hydrocolloid itself, okay? So now we need to use the Tegaderm. And I would cut this lengthwise to seal around the edges of your wound. So you're sealing the Tegaderm onto your gauze, onto your hydrocolloid, and onto the patient's skin itself. So you're creating your cage. So you need to do this on all sides, making sure your Tegaderm does not cover the central area of your wound, just the edges. Okay, so the Tegaderm's on both sides. It's on the skin the whole way around, and my gauze is covered with the Tegaderm as well, leaving the central area open so that the maggots can breathe and also the discharge can come out through the gauze. So that's your primary dressing. Your primary dressing will stay on for 2 days untouched. All you need to do is put some secondary dressing on, which is your gauze, sealing it with some tape, which has to be changed on a regular basis whenever there's any discharge soaks through. So we roughly say every 2 to 3 hours just to check the dressing, the secondary dressing, okay? So we just use some gauze. Okay, so I would normally use 2 to 3 pieces of gauze on top, and then we could just use the tape to seal the edges. Try not to use too many pieces of gauze because the gauze could cause the maggots to suffocate. And you need to allow the maggots room for expansion because they are going to grow in size. Okay, and that's your secondary dressing. And as I say, the secondary dressing should be changed roughly every 2 to 3 hours with any discharge noted on it.